Welcome to the channel. And now it's time for the Graybeard Insurance Guys. They are here to help with all your insurance questions. And without any more delay, here are those graybeards everybody knows and loves.
It's your Medicare graybeards back at it. So what happens if you turn 65 and forget to enroll in Medicare Part B? You could be left without coverage for doctor visits, outpatient care, medical equipment, and many other important services. You might also face a late enrollment penalty that could follow you for as long as you have Part B. Joe, what in the dickens is Part B anyway?
Corey, a world without Part B is not a world most Medicare beneficiaries want to live in.
By the end of this video, you'll know exactly what your Part B covers, when to enroll, and how to avoid a penalty that can follow you for life. If you appreciate this type of content, go ahead and just tap that little like button down there. And before we get started, just so you know, this is just an educational video. If you have questions, go ahead and look us up here. Let's get started. Today, we're answering an important question. What exactly is Medicare Part B? Why do you need it? Joe, let's start with the basics. What does Part B cover?
Medicare Part B is the medical insurance portion of original Medicare. Part A generally helps with inpatient hospital care. Part B generally helps with medically necessary and preventive services you receive outside an inpatient hospital stay. That can include doctor and specialist visits, outpatient care, preventative screening and services, ambulance transportation when medically necessary, durable medical equipment, laboratory work and diagnostic testing, outpatient mental health services, physical, occupational, and speech therapy, certain vaccines, certain medications administered in the doctor's office or outpatient setting. Without Part B, you could be responsible for paying the full cost of many of these services unless you have other insurance that covers them.
So that's quite the list. And basically, Part B is what helps cover a lot of the everyday medical care people commonly use, right?
That's correct. Part B is also generally required if you want to enroll in a Medicare Advantage plan. To join most Medicare Advantage plans, you must have both Medicare Part A and Part B. That's original Medicare Part A and B. And you must continue paying your Part B premium.
How does somebody approaching age 65 avoid missing this Part B?
For more people, the initial enrollment period lasts 7 months. It starts 3 months before the month you turn 65. It includes your birthday month. It ends 3 months after your birthday month. My recommendation is to begin reviewing your Medicare situation during the first 3 months of that enrollment period. In other words, start about 3 months before your 65th birthday month. Don't wait until the last minute. If you are already receiving Social Security, you're going to be given Part A and Part B by Medicare and Social Security. But you want to
Okay.
make sure that occurs. So if you don't see your card in the mail 3 to 4 weeks after the first or the third month before your birth month, you'd want to start checking into it perhaps because it's getting a little close to there. You have plenty of time left, but you don't want to miss a mailing if you've just moved and you haven't notified the post office and they don't know where to forward it. So if you don't see it soon after that first month starts, you might want to check with your Social Security folks to find out if everything is okay.
Okay. Can someone enroll through Medicare directly?
Enrollment in original Medicare is generally handled through the Social Security Administration. You can apply online at ssa.gov, call Social Security, or contact a local Social Security office. Some people are automatically enrolled, particularly if they are already receiving qualifying Social Security benefits before turning 65. Always verify whether you will be enrolled automatically. Don't simply assume that your card will come.
When should somebody's Part B coverage actually begin?
If you enroll before your birthday month, your coverage will generally begin the first day of the month you turn 65. That's for the Part B coverage. There is one important exception. If your birthday is on the first day of a month, Medicare generally treats your eligibility as beginning the month before. If you wait until your birthday month or later, your coverage timing may be different. That's another reason to get started early.
Okay, quick break just to remind everybody and let everybody know this is purely an educational video, and we did put together a free Medicare quick start list that walks you through this whole timeline step by step. So the link's in the description down below, and it's pinned in the first comment below. All right, let's get back to this. Now, Joe, how long does it take to receive the Medicare card?
Processing and mailing times can vary. Rather than promising that every card will arrive within a particular number of weeks, check the status of your application through your Social Security account. Once Medicare creates your record, you may also be able to access your Medicare information through your secure Medicare account.
What should someone do if the card hasn't arrived yet or their enrollment isn't showing up?
Or you can contact your Social Security office and verify that the application was received, whether additional documentation is needed, the effective date of Part B, which is very important, whether the enrollment has been completed. Do not wait until the last few days before you need coverage. That means that third month, just before your birth month. If you're in that and you haven't gotten your MBI number, Medicare beneficiary number, you may miss that first month. So you've got 3 months to verify that you have an MBI number. Then you can enroll even if you don't have the card in hand, because you can get that number from Social Security. You're on your way. Once you have that number, then all the insurers will have access to it and you can enroll right then and there once you determine what plan you want to get.
Good point. Does everyone have to enroll in Part B as soon as they turn 65 and get Part A?
Yes. But not necessarily. Some people can delay Part B without a penalty because they have group health plan coverage based on their own current employment or their spouse's current employment. But this can get complicated. The size of the employer can affect whether Medicare or the employer plan pays first. That is why someone working past 65 should talk with the employer's benefits administrator and confirm the rules before delaying Part B. Do not assume that all insurance allows you to safely delay Part B.
Okay, so then what about COBRA, retiree insurance, marketplace insurance, or even VA benefits? Tell us about that.
All right, those types of coverages have different Medicare coordination and enrollment rules. For example, COBRA and retiree coverage are generally not considered coverage based on current employment for the Part D Special Enrollment Period. Someone relying on one of these plans could still face a coverage gap or Part B penalty. Before delaying Part B, get advice based on your particular coverage.
So what happens if someone misses that deadline and they forget, something happens, or they just don't do it and doesn't qualify for one of the special enrollment periods?
Well, I'm glad you added some of those qualifiers in there, Corey, because it doesn't matter as to the why you don't get Part B. What matters, or could matter to you very much so, is that you do not get it. So they may have to pay a Part B penalty, late enrollment penalty, if that occurs. The penalty is generally an additional 10% of the standard Part B premium for every full 12-month period the person was eligible for Part B but did not enroll. For example, one full 12-month period could mean a 10% penalty. 2 full 12-month periods could mean a 20% penalty. 3 full 12-month periods could mean a 30% penalty. The penalty continues for as long as the person has Medicare Part B. They could also experience a period without the coverage they need, and that is extremely important.
It just keeps growing. That means it's not just a one-time late fee.
No, in most cases, is added to the person's monthly Part B premium for as long as they have Part B. That is why enrolling at the right time matters.
Well, once someone has their Medicare card and they have both the Parts A and Part B, can an agent help them compare with the Medicare Advantage plans then?
We would have to set up a scope of appointment with them, which is very simple. That's necessary and important. And then a licensed insurance agent can help them review available Medicare Advantage plans and compare important details such as doctors and hospitals, prescription drug coverage, co-payments, maximum out-of-pocket limits, dental, vision, and hearing benefits, plan service areas, prior authorization requirements. Some Medicare Advantage plans may have a $0 additional monthly plan premium, but availability varies by location. Remember, a zero plan premium does not mean Medicare is completely free. You must continue paying your Medicare Part B premium, and the plan can still have co-payments, deductibles, and other costs.
Okay, that makes a lot of sense. But let's just give everyone the straightforward, brass tacks, simple version.
Okay, here it is. First, learn when your 7-month initial enrollment period begins. Second, determine whether you'll be enrolled automatically or you need to apply through Social Security. Third, never delay Part B based on an assumption about employer, retiree, COBRA marketplace, or other coverage. Finally, once you have Part A and B, speak with a licensed agent who can help you understand and compare the Medicare coverage options available where you live.
That sounds easy enough. So when you start early and get the right information, correct? And if you are approaching age 65, have questions about Part B or your Medicare options, contact us before your enrollment deadline. We can help you with answering all of these questions. If it seems confusing, we can simplify it for you. Click the link below and reach out, and we will respond to you personally. Joe, thanks for helping us understand what Medicare Part B is all about.
You are correct, sir. Start early, ask questions, and don't let Part B catch you by surprise.
And if you want to go deeper, click on the link below, schedule a time. And we've made some videos that cover all of this more in depth as far as your Advantage plan and even on into the Medigap plans. You can check it out, and we're glad you came by to see us. Thanks for watching. We'll talk to you again soon.
Thank you all very much.
That's all for the Graybeard guys for today. We'll bring them back next time for more great insurance insights later. Everybody have a great day, and remember, it's great being a Graybeard.